Now I'll turn to Dr. Sharma. Sir, what are some of the risk factors for developing CAD?
Yes.
Could you outline these risk
Yes.
factors for us?
As Professor Geelani said, that the key pathology feature of the coronary artery disease is that atherosclerosis, the deposition of cholesterol plaque inside the coronary artery, and on the top of this plaque, blood clot forms and occludes the coronary artery, and that is what gives rise to this problem of acute or chronic coronary artery disease symptom. Now, there are risk factors. They are truly not the cause, they are just the risk factor. So we have two sets of risk factors. One group of risk factors are unmodifiable. We cannot modify by any intervention. They are like age. As person ages, chances of coronary artery disease or atherosclerotic disease increases. Male sex, comparing in the population, males have more propensity to develop coronary artery disease. Female have that immunity, protective immunity from the estrogen. So till they reach menopause, they are relatively immune to coronary artery disease. But once they reach menopause, thereafter, their propensity to develop coronary artery disease becomes nearly same as male. So another is a male sex. And third is a family history. If there is a strong family history, especially the father develops coronary artery disease below the age of 50 and mother develops below the age of 55, then chances that children have coronary artery disease is more. So these are the three non-modifiable risk factors, which we cannot modify. We cannot modify the age, we cannot modify the sex, we cannot modify our genes. But there are set of modifiable risk factors. Commonest in the population is the diabetes, overweight, that is obesity, smoking, high blood pressure, physical inactivity, the dietary pattern, diet rich in saturated fat. So these are the modifiable risk factors. We can control diabetes, we can control hypertension, we can control our weight, we can engage in physical activity. So we can stop smoking. So these are the risk factors which we can control. So that's how these are the modifiable risk factors. So if we see in totality, in majority of the population have risk factors, those who develop coronary artery disease. But something around 28 to 30% of people, you do not find any of the risk factors. Still they get coronary artery disease. So to summarize this risk factor thing, these modifiable and non-modifiable risk factors are there, but not that everybody who has this risk factor would develop coronary artery disease. Majority may develop. Similarly, those who do not have any of the risk factors, not necessarily they are immune to coronary artery disease, they can also develop. Okay. So we have to identify risk factor and accordingly intervene.
If I understand correctly, sir, as you made a distinction between risk factors of two types, right? Age, sex, and our genetic makeup. Those are the factors which are beyond our control. We can't change them. And the second set of risk factors, which pertains to our behavior, our lifestyle. Those are things which are to a large extent within our control. Our eating habits, our lifestyle, do we smoke tobacco, even diabetes to a certain extent, I suppose. From this, I would like to ask you, sir, Dr. Sharma, would you describe that among the second set of risk factors, would you say that the patient who is more likely to develop coronary artery disease, should he or she suffer from a certain combination of these risk factors? Or are you prone to developing the disease, even if you are just a smoker, you're not a diabetic, you're not a hypertensive, you have an active lifestyle, but you are just a smoker. So does that put you at an equal risk of developing the disease, or is it a certain combination of these factors?
See, anybody can have any of the risk factors, any of the modifiable risk factor can develop coronary artery disease. If someone is only diabetic, he or she can develop. If someone is only smoker, he or she can develop. But when there is a combination of risk factors, if someone is diabetic, hypertensive, overweight, and also a smoker, his chances of developing coronary artery disease become very high.
Right.
And especially the when we talk about some of this modifiable risk factor, their effect when they are together in a person, their effects are not additive, it is multiplicative.
Okay.
So when we talk about say like, if we see in the population, what are among these risk factors, which are the commonest one? So if we see the commonest one are diabetes. In population, almost the 23 to 25% population is diabetic, and equal number of people are so-called in pre-diabetic stage. So diabetes is one of the major risk factors. Majority of these diabetics are either hypertensive and also obese.
Right.
Similarly, the smoking or tobacco consumption in any form, not necessarily smoking only, even chewable tobacco. So tobacco consumption in various forms is quite common, especially the young population who may not be diabetic, but they are mostly obese and they are a smoker.
Right.
The middle-aged and elderly population, they are diabetic, they are chewing tobacco or smoking, and also the obese. Similarly, the majority of this diabetic are hypertensive also. So
Right.
most of the time there is a combination of risk factors.
Right.
So even the one risk factor in isolation can produce coronary artery disease, but when the risk factors are together, their effect gets pronounced.
Right. If I understand correctly, sir, combination of risk factors, more than one risk factor, as you said, is not additive, but it's multiplicative.
Yes.
So the probability of the patient who has several risk factors, who could be a smoker, who could be a diabetic, could be a hypertensive, could be obese, and could be leading a very unhealthy and sedentary lifestyle. So such a person would be at a much higher risk of developing the disease. Is that so? Right.
Yes.
Okay.